Hello everyone, I am Archana. Today we have Dr. Meenakshi, consultant pediatrician at Motherhood Hospital, Chennai. Can you tell us about what is autism?
So autism is a common problem that is being increasingly diagnosed in today's world. What we should understand is autism is not a disease. It is a developmental condition. Autism is basically a problem related to social interaction. The way the child is interacting or behaving with the environment around him or her, how the child is able to talk, how the child is able to communicate its needs. So this is what is called autism.
Why should you identify it early?
The first 3 years is very important in the child's growth and development because the brain is still growing at this stage. So early identification of this problem will lead us to early intervention so that the child is able to attain its maximum potential.
Doctor, what are early signs of autism?
Autism has been suspected even as early as 6 months of age. When a mother has reported that her baby is not looking at her face and smiling. If the child is not waving bye-bye at around say 9 months of age, at around 1 year of age, we expect the child to babble. The child is not responding to name call. Like when you call the child's name, the child should look at you. So the child does not have a good eye contact. Then we suspect autism. Usually by 1 year, the child should be able to utter one single meaningful word. So when there is a delay in speech and language, then this could be a signal for suspecting autism. By around 1.5 years of age, the child should be able to point its needs and they should have some kind of a pretend play, like playing with toys. When you play with your baby doll or a teddy bear, feeding the doll some water or feeding the doll with a spoon. This is what is called pretend play. So when all this is not there, then it will raise an alarm. The parents also notice that they are sometimes fixated with some toys, like to look at the spinning of the car wheel, or they play with toys but they play it in a little abnormal way. They don't use their imagination to play with toys. They like to stock everything in a line. They just keep putting all the toys in a line. So these kind of things also raise the suspicion. Sometimes they have repetitive play. They keep doing the same thing again and again. They have some repetitive movements like hand flapping, or whatever you talk, they just repeat it back. That's called echolalia. So they're not interested in playing with other children. They like to be in their own world. All this are some pointers towards autism. If you find any of these signs, what I have mentioned below, don't panic. So every symptom or sign what I talked may not be a sign of autism. But when you have any doubt or concerns regarding your child's development, just approach your pediatrician and talk to them, because we do evaluate these children and start them on basic therapy like occupational therapy, speech therapy. There are measures that are available to deal with these children. If started on early intervention, these children do well in future. Thank you.
Thank you.